In healthcare, the right conversation at the right time is critical for both clinicians and patients. Quality and timely communication is at the core of the safe, high-quality care experience we all hope to receive.
Mrs. Cruz turns her head to you and opens her eyes, but doesn't try to verbalize a response. At this point, you ask her if she knows where she is, only to receive a blank stare. After further examination of Mrs. Cruz's cognitive and physical abilities, you determine she does not have the capacity to make her own healthcare decisions.
Based on what I'm seeing right now, I believe that Mrs. Cruz is unable to act on her own behalf with regard to her healthcare decisions. Because of that, I want to activate the healthcare proxy.
Healthcare providers today are overwhelmed by the variety and volume of critical communications and the lack of appropriate communication training regarding life and death issues. Our immersive simulations currently address advanced care planning.
Can you give me an idea of what she's been like at home over the past few months?
She just seems to be getting worse. Mentally, she's not always herself. And when she is, she just demands that we cater to her.
Another simulation addresses having difficult conversations.
Please calm down.
Calm down? No one tells me what to do in front of a patient.
You are clearly agitated and should calm down for the patient's sake.
Are you kidding? You didn't need me. The fellow is the best we have.
If your fellow had been trained properly, your job would have been done.
You would have learned more with a question than with a directive.
Our current product pipeline for 2018 includes prescriber training for opioids as well as patient training to help newly diagnosed diabetes patients understand the ABCs of their disease and their role in their program of care. Traditional training approaches are simply not keeping up with the needs of caregivers or their patients. There are not enough trainers, classrooms, or standard patients to keep up with ever-increasing demand. Mannequin-based SimCenter training, while effective, doesn't fill the void because it isn't easily scalable. At ConverSage, we build effective learning experiences focused on critical conversations about complex, high-stress topics that have a profound impact on improving the quality and safety of care. Leveraging our more than 25 years of experience in physician communication and leadership training, we build military-grade, asynchronous, and immersive curriculum to deploy across the continuum of care. These curricula are complex, realistic, replicate various stages of illness, and can integrate real device training. Our LMS-ready learning environments deliver materials in a time-efficient and low-stress manner and are better retained by the learner. These learning experiences can also be used for practice and ongoing performance improvement. ConverSage, the right conversation, the right care.